Good morning, everyone. We're going to wait just a couple of moments till our attendees to get logged on and our panelists and guests to get settled. For our panelists, if you've yet to, and I guess if you've yet to rename yourself from DACLAC member and guest, if you could rename yourself to your actual name, that would be great. We'll know who has joined us this morning. So good morning. This is the Disability and Aging Community Living Advisory Committee meeting, or DACLAC, DACLAC. Today is June 12th, 2025. Today is 10 a.m. Today is 10 a.m. Today is June 12th and is 10 a.m. and this meeting runs from 10 to 1 p.m. We will have a break. Let's go to the next slide. Good morning. I am Carol DeAndres, and I am the Stakeholder Engagement Manager for the Master Plan for Aging, MPA, here at the California Department of Aging, CD8. Nice to be with you. A few meeting accessibility notes. We do have American Sign Language. Thank you, Summer and Connie, I believe, is our new ASL person. So thank you for joining us today. We have closed captioning that is also available to you. To initiate that, please hit the CC icon on your Zoom toolbar. My toolbar is at the bottom. Show captions and click View Full Transcript to review previous caption text. If the CC icon doesn't appear on your toolbar, try that More selection. It's 3 dots. It might be hiding under there. Next slide. Meeting logistics. We will be posting the slides, the PowerPoint slides, the transcript of this meeting, and the recording will be posted to our California Health and Human Services, or Cal HHS Agency MPA DACLAC meeting page. Committee members and guests on our panelist side, if you've yet to do so, please update your name display in Zoom by right-clicking in the upper right corner. Please turn on your video so we know that you've joined us. And if you have any, if you have any trouble, please raise your hand or come off mute, and we're happy to help you. Virtual meeting operations. The chat function is enabled for committee members, our guests, and CDA staff to share out meeting-related resources and information, and the public's able to view that content in the shared in the chat. The chat and the Q&A function is not enabled for comments or questions from the public, but we do invite you to provide oral comments during our public comment period, which is in the agenda. And of course, at any time, you can send written comments to our Engage email box at engage, E-N-G-A-G-E, @aging.ca.gov. Just to let you know how the public comment period will work, attendees joining by phone can hit the *9 on the dial pad. That will indicate to us that you wish to leave a comment, and we will unmute your line. And attendees joining by the Zoom webinar functions, you have a raised hand icon on your Zoom toolbar. Feel free to click on that. It will indicate to us that you would like to leave a comment, and we will unmute your line. Please note that public comments will have 2 minutes, just so we know that we can get to everyone who wishes to leave a comment. And of course, at any time, please send us your written comments to engage at ENG. Let's try that again, ENGE @aging.ca.gov. The committee purpose. The purpose of the Disability and Aging Community Living Advisory Committee, or DACLAC, DACLAC, is to advance community living, inclusion, and integration across California. DACLAC will ensure the involvement of individuals with physical and intellectual disabilities, older adults, and other partners who provide services or represent consumers. DACLAC will advise the California Health and Human Services Agency, or CalHHS, in addition to other state entities, on community living policies and programs, including but not limited to long-term services and supports, transportation and housing, and employment opportunities. And of course, we couldn't fulfill the committee purpose without our esteemed committee members. So we would like to thank all of our committee members, our stakeholder co-chairs, Sherry Burns and Hagar Dickman, and our state co-chairs, Director DeMorris and Director Rutledge, and all the committee's members that make up the DACLAC. Okay, and I think that and just a brief overview of the agenda. We will have an open remarks from Director Rutledge. We will have a discussion from DACLAC, a presentation from our DHCS Director Boss, public comment, a break for us. DACLAC will then move into our subcommittee discussions. Subcommittee include the HCBS, Home and Community-Based Services, Housing and Transportation, and another public comment period, and then we will have closing remarks. So with that, I will turn over to Director Rutledge. And hold on for just, if you can unmute.
I'm sorry, Miss Carol. My name is Connie Martinez. I am the ASL interpreter. Sorry to interrupt you, but could you please co-host me? Because my colleague and I will be taking turn every 15 minutes. I will
do that.
Thank you, ma'am.
Thank you. Director Rutledge, let me spotlight you. I'm so sorry. Thank you, Director Rutledge. Please go ahead.
All right, great. Thank you so much, Carol. Good morning, everyone. I'm Kim Rutledge, the director here at the Department of Rehabilitation, and I'm honored this morning to welcome you all to the summer 2025 DACLAC meeting. And it's been a few months since we were all together. I was going back through my notes, and our last DACLAC meeting was in March. And I think it's fair to say that as a state and as a disability community and beyond, a lot has happened since the last time that we were all together. We have seen, both state and federal budget proposals that have significant impacts on the communities that we serve. We also have seen, the current situation that is happening in Southern California. We've also are still recovering from the LA fires and many other things. So far 2025 has been a challenging time. And this group is made up of many of you who are very strong advocates in the work that we do. And we have seen you out doing your advocacy, especially at budget committee hearings and in other arenas over the last few months. And so on behalf of myself and Director DeMorris and all of us who convened this meeting on behalf of the state, I just want to start out by acknowledging the difficulty that the last few months has been. And thank you all for the hard work that you're doing on your ends. We have certainly seen the results of your work, especially with the legislature's proposals for the state budget that are going to be discussed later in this meeting. But we just want to say that we are here with you, we understand, and acknowledge that a lot is going on as a state right now. There's also been a few positive things that have happened and are planned in the coming months as well. And I'm happy to talk about a few of those. Since we were last together, one of the most significant things that has happened in our state is the release of the Master Plan for Developmental Services. This was a year-long effort that was really a collaboration between state government and many, many community partners, including many of you on this call today, to holistically look at ways that we as a state can improve the work that we're doing to best serve individuals with developmental disabilities. That report is out now, and state entities and partners are all working together on the best ways that we can move forward with implementation for the Master Plan for Developmental Services. I believe someone has put a link to it in the chat here, and I highly recommend that folks take the time to read the Master Plan on Developmental Services. It is a long document, but it's also written in very plain language in a way that we hope that all advocates and individuals even that are impacted can easily understand it. And it really also is a call to action to all of us who work with this population to serve them in the most thoughtful and appropriate ways possible. So really appreciate all of the work that everybody in the community and at the state level both did to make this happen. Moving ahead, there's a few things that are coming up that I'd also like to briefly talk about. July is coming up, Disability Pride Month, as well as the anniversary, the 25th anniversary. Is that right? I have to do my math. 35th. I'm sorry. I was 10 years off. The 35th anniversary of the passage of the Americans with Disabilities Act happens in July, as well as Disability Pride Month. And DOR is going to be partnering with the Department of Developmental Services and the Department of Social Services to put on an in-person ADA and Disability Pride event here in Sacramento. And we'll be making sure that everybody in this group has more information about that once those plans are finalized. Finally, I want to announce a couple of new hires that we have here at the Department of Rehabilitation. First of all, start joining us here in about 2 weeks. We have a new deputy director over our Independent Living and Community Access Division, and that is LaCandace Ochoa, who was appointed by Governor Newsom a couple weeks ago. LaCandace worked at DOR many years ago and then moved on to do a lot of work in a number of disability spaces as well as our community college system, but has always, been a great partner in the independent living space, and we're really excited to have her join us. And we'll make sure that she has an opportunity to introduce herself the next time that DACLAC gathers. I'm also excited to introduce to you all this morning Dante Allen, who is probably a very familiar face to many of you, as he has been a longtime champion of disability issues here in California. And Dante has joined DOR as our new Deputy Director over the Office of Legislation and Communications. I want to take a moment to read Dante's entire bio because Dante, as I mentioned, has done a lot of work in our space over the years, and we're just really excited to have him on board. So Dante Q. Allen is the Deputy Director of the Office of Legislation and Communication at the California Department of Rehabilitation. Prior to joining DOR, Allen served as the Commissioner of the Rehabilitation Services Administration within the U.S. Department of Education, Office of Special Education and Rehabilitative Services, a role for which he was nominated by former President Joe Biden and confirmed by the United States Senate. Prior to his federal appointment, Allen launched the California Achieving a Better Life Experience, or CalABLE, California's ABLE Act savings and investment program for individuals with disabilities. Under his leadership, CalABLE became the nation's fastest growing ABLE program, significantly improving financial inclusion for people with disabilities. Allen also served as a communications leader in the public and private sectors. He served in the California Department of Public Health's Office of Health Equity as a senior communications officer, and at Kaiser Permanente, where he served as the communications director for the organization's senior operations executive. Born with spina bifida, Allen is a full-time wheelchair user and a staunch proponent of disability rights and equity. He has been a champion in advocating for the awareness of the reduction of healthcare and financial disparities, especially among people of color and people with disabilities. Allen received his undergraduate degree from the University of California at Davis and a master's degree at the University of Southern California's Annenberg School of Journalism and Communication. Dante was appointed by Governor Newsom to his new role on April 18th. So I'm going to give Dante the opportunity to say a few words to everyone.
Thank you, Kim. Good morning, everyone. It is an absolute pleasure to join you all. But let me say what an honor and pleasure it is to be an official employee and staff member of the Department of Rehabilitation. I can tell you from my experience with RSA that there were just a few state agencies that were at the very top of what is achievable for individuals with disabilities in this country. And California was a standout even among those agencies. So to be a part of the direct service that's going on here is both an honor and a privilege. I am a staunch fan to work with Kim and the other folks here in the department is truly an honor. I am excited about the opportunity that I feel like we have here in the Department of Rehabilitation, especially as it relates to the impact that we can have on legislation and communications. And really, I want to be instrumental in helping our community better understand who we are and what we do to bring more folks into the fold, and so that we can have as great an impact as we can on as many individuals with disabilities here in the state. And so I'm looking forward to that. I am also very proud to work with Kim because I know that she understands and appreciates the impact that communications and our relationship with elected officials can have on the work that we do. So she's a supporter and will help us to move things forward. And so I'm really excited. So it's my pleasure to get to know you all and look forward to continuing our discussions.
Thank you so much, Dante. And with that, I will turn the meeting over at this time to Hagar Dickman from Justice and Aging, DACLAC Stakeholder Co-Chair.
Good morning, everyone. Thank you. Just wanted to remind everyone to please change your name from DACLAC member to your name and organization. And you can do that by actually clicking on the participant bottom on the button on the bottom of your screen, and then finding the little red thing that says me on it. And then you can click on the little three dots and click on rename. And then that will let you rename yourself. And at this time, we're going to hear from the Director of the Department of Aging, Susan. Good morning, Susan.
Hi, Hagar. Good morning, everybody. I think I'm actually on the agenda a little bit later after our break.
Oh, I thought I was supposed to introduce you. Sorry.
Oh, hello. Thank you for the kind
Hi.
introduction.
Sure. Good morning. Good to see you.
You too. Good to see everybody.
All right. So it does say me. I have to introduce you. All right. So I'm going to actually take a few moments to speak about some urgent issues in California, and my co-chair Sherry is also going to speak with me. Hi, Sherry. Good morning. I'm going to
Good
speak.
morning.
How's it going? I'm going to speak a little bit about urgent issues in California, and then I'm going to turn it to Sherry, who's going to focus us on some urgent issues coming from the federal government. So this has been a tough 6 months for California, from destructive wildfires to facing a very difficult budget that threatens essential programs to being targeted by the federal government for racist and cruel deportation efforts, Medicaid cuts, and more. In the period of great turmoil and instability, it's even more important to remind ourselves of our core values. And for the Disability and Aging Community Living Advisory Committee, that means uplifting and supporting policies that ensure all Californian older adults and people with disabilities can live in the community setting of their choice. Since the governor released his revised budget proposal in May, DACLAC members, and especially consumers of our home and community-based programs in the state, have tirelessly been calling and writing representatives in the state legislature to oppose cuts that would reduce access to Medi-Cal and Medi-Cal programs. And the legislature's proposed budget has been partially responsive to that advocacy, rejecting some of the governor's more harmful proposals that specifically hurt older adults and people with disabilities. For example, the legislature recommends reinstating the asset test for older adults and people with disabilities to $130,000 for an individual instead of the proposed $2,000. There was in that proposal a full rejection of cuts to IHSS overtime and travel hours, a full rejection of cuts to IHSS and long-term care for undocumented immigrants, and one-time additional funding for a home safe and housing and disability advocacy program. The legislature's cuts, unfortunately, include also some harmful policies, including freezing enrollment to Medi-Cal for undocumented immigrants and other individuals with unsatisfactory immigration status, with a 6-month grace period on the one hand, but with an expansion to including individuals with this unsatisfactory immigration status, which the governor's original proposal didn't have. Implementing $30 per month monthly premiums for Medi-Cal for undocumented immigrants and other individuals instead of the $100 originally proposed. And approving the elimination of dental coverage in Medi-Cal for undocumented immigrants beginning July 1st, 2027. To achieve DACLAC's goal to ensure community living is accessible for all California's older adults and people with disabilities, California must, even during bad budget years, prioritize equitable, accessible, and comprehensive services for all Californians. And as the legislature and the administration continue its negotiations within the next few days, these proposals, both the good and the bad, are not yet a done deal. If you'd like to continue your advocacy to both support the positive parts of the proposals and objecting to those that continue harming California's older adults and people with disabilities, you can call the governor and your representative to have your voice heard. And with that, I'm going to pass it to Sherry. Thank you.
Thank you, Hagar. As Director Rutledge shared just a few minutes ago, many of us are very concerned about the Trump administration's uninvited military response to the protests happening in LA this week and threats to do the same elsewhere around the country. Also, on the federal level, the 2025 House budget bill that passed on party lines last month includes a range of provisions impacting taxes, spending, and social safety net programs. It aims to cut spending by $1.7 trillion, potentially allowing a $4.5 trillion increase in the deficit through permanently extending the tax cuts from President Trump's first term and adding $3 trillion to the national debt. Some key elements of the bill now being reconciled in the Senate include $5 trillion in permanent tax cuts, mostly benefiting more wealthy Americans, $800 billion in cuts to Medicaid, and new eligibility requirements making it more difficult for qualified people to apply and retain the Medi-Cal benefit. The Congressional Budget Office estimates at least 7.6 million people, including older adults and people with disabilities, would lose their Medicaid. Thirdly, eliminating Medicaid coverage for long-term care for people whose home is valued at $1 million or more, forcing people to sell their home to pay for their long-term care. Would also end all Medicaid expansion services, screen out all non-citizens from enrolling in Medicaid, create changes to the insurance marketplace, establish work eligibility requirements and cuts to the SNAP, or what we call in California, the CalFresh food stamp program, create an overhaul of the student loan system and cuts to loans, eliminate clean energy tax credits, provide $60 billion in subsidies to farmers, mainly needed because of the negative effects of the tariffs, remove the tax-exempted status for nonprofit organizations that the administration claims support terrorism, a temporary increase of $2,000 to the standard deduction on tax returns, and a temporary $4,000 increase in the standard deduction for seniors, which on surface seems very positive, but again, that is very temporary. Increase funding for the Pentagon, include a $25 billion Golden Dome missile defense shield and a $34 billion expansion to the naval fleet. And then increasing funding for border security, mass deportation efforts that are already underway, and $46.5 billion to continue wall construction along the US-Mexico border. While a handful of Republican senators have verbalized concern about the cuts to Medicaid and SNAP being too steep and would not vote for the House bill as is, another handful of Republicans are concerned that the cuts aren't steep enough and want to see $2 trillion in cuts as opposed to $1.5 trillion. While our California senators are opposed to the House bill, it is still important to communicate your concerns, your thoughts, and your stories to them. Now, Hagar and I would like to open up a discussion and thoughts shared from the DACLAC members about these and other state and federal pressing issues. And we'll have a chance at the public comment period for the public also to verbalize any thoughts that you have about these bills, and both on the state level as well as the federal level, and then all of the immigration issues that are happening and with protests down in Southern California and elsewhere around the country.
Sherry.
Yeah.
Yeah.
I was just going to say, I think people can raise their hands or put comments in the chat either way. But this is a sharing time among the DACLAC members.
Hi, Corinne, did you want to speak?
Yes. Good morning, all. I just wanted to throw in one little comment. I come from the era of the late 60s where there were protests and I can vividly remember even as a child when the streets were occupied by the tanks and what have you. And it's just a very sad feeling, a very sad state of affairs to see that again. I think it inappropriate to say the least. And I'm afraid, and I'm afraid because I cannot imagine what our state is going to look like if someone inadvertently, either a guardsman or a Marine inadvertently fires even a rubber bullet and hits someone, and what the effect of that can be. And it just tears my soul apart to even think about it. And I know I'm in a common space, and so I feel comfortable saying that, and I'm glad you gave me the opportunity.
Thanks, Corinne, so much. Michelle?
Yeah, I want to basically say the same thing. I think there's so much unrest from day to day going on in the US, let alone here in California. I just want people to know that they're not alone, this unrest, and I basically feel like we're being attacked in a way, with our social services and our services. So just stay diligent, stay on top of what's going on so that you can fight back in your own way by talking to our legislators and our people in office so that they understand what's going on, and from your point of view that this isn't okay, and to just keep putting that out. Thank you.
Thanks, Michelle. Andrea?
Yes, I definitely want to welcome everyone. I definitely want to recognize what's going on. It's extremely sad, and it really speaks to why it is so important for us to come together, agency come together with consumers and family members, because we need each other. When we are separated, we are not strong. And so this is a reminder of how important it is to support everyone, because everyone deserves a better way of life. And it's a reminder of how important it is for us to come together as small communities, as families, as agencies, and then also helping other people that do not have a voice. Because again, we are not strong when we are apart and when we have division. We are all human beings seeking the same opportunities. So thank you for allowing me to speak.
Thanks, Michelle. Andrea?
Thanks, Michelle. Michelle?
Yes, I definitely want to welcome everyone. I definitely want to recognize what's going on. It's extremely sad, and it really speaks to why it is so important for us to come together, agency come together with consumers and family members, because everyone deserves a better way of life. And so this is a reminder of how important it is for us to come together as small communities, as agencies, and then also helping other people that do not have a voice. Because again, we are not strong when we are apart and when we have division. We are all human beings seeking the same opportunities. So thank you for allowing me to speak.
Thank you, Michelle. Sylvia.
Yeah, and I think we all share the same feelings about that. But for the past few days or since January, I feel powerless. I just feel like there's so many wrongdoings, and there's so many legislator, even our Governor Newsom, oppose what he's doing in our country. But it seems like it's too slow process to make the justices. And I don't know what will lead to us. I think it's more and more coming on that. And we are worried. I mean, we are in Bay Area. What's happening in LA will be coming to the whole California or even to the whole United States. And I just feel very powerless. And I go to church and there, we are really protest on that, but it seems not enough for us to make the voice heard.
Thank you, Sylvia, and thank you, Andrea. Sabrina?
Thank you, Hagar and Sherry, for giving us this platform. I'm based in Los Angeles, and I have been watching with horror as my neighbors have been violently kidnapped in the past few weeks by the federal government's actions. But I am also thinking about the violence that is ripping healthcare away from people, that's proposed in the state budget this year for people with unsatisfactory immigration status. So I just encourage folks to connect the dots here and think about, violence has many forms. Taking away people's needed services is also deeply violent. And I hope we as California can do better and stand up to the federal government on this and continue to provide long-term services and supports, IHSS, and other services to people with unsatisfactory immigration status.
Thank you, Sabrina. Janie?
Did we lose Janie?
She took her hand down. She's talking, but
Oh,
No, there we go.
Oh.
there we go. You're back.
I'm back. I just wanted to say this is Janie Whiteford from SECA, California IHSS Consumer Alliance. How incredibly happy we are with the with the changes in what the governor is now proposing for IHSS. The bill that's in the budget bill now, and I just am so pleased with the number of people who have really stepped up and advocated. I know all of us, all of our organizations were giving our folks ways to get in touch with their legislators, how to do that, prompts for speaking. And I think that that's one positive that we can see through all this is that we have really increased, I feel like, the number of advocates that we have. Those folks that normally would not be advocating, but really see the need now and have stepped up. So kudos to all of us that have done that work. And I think it's only going to increase because, as everyone is saying, the need is definitely there. And we have to have all of our folks get involved. Thank you.
Thank you, Janie. Appreciate your comments as well. Debbie.
Hi, folks. Debbie Toth with Choice in Aging. I really appreciate this conversation, and I want to echo all of the sentiments of everybody who spoke before me, particularly Janie, uplifting positivity in this time of not so much positivity. I am incredibly grateful to all of the advocates that have been showing up in whatever way they are able. I am also grateful to the legislature for stepping up and saying no to reinstating a 1980s whatever asset test. I am disheartened to see the attack, I feel like that's my word, in California on folks who are immigrants and folks of color in the governor's may revise. One particular cut that just felt particularly ugly to me was the removal of DEI training for the regional center workforce. That is something that I've heard personally from regional center board members, how impactful that training was last year for their staff. I think that anti-Black racism and racism in general are obviously being given voice to be okay in our country. And I think as California, we need to stand very firmly that that is not in our value system. And I hope that other people rally around that particular cut. And obviously all the other cuts that we've talked about today. I think this is time for California to continue to be the leader, and protect people that are older, protect people that have disabilities, and protect people that are not white. Thank you.
Thank you, Debbie. Megan?
Thanks, Cigar. Hi, I'm Megan Burke with the SCAN Foundation, and just want to, I think, acknowledge all my committee members' comments that have come forward, and I think speak to how disheartening I think it was with the governor's May revise with so many proposed cuts to long-term care and LTSS. When we sit here day in and day out and we have these master plans that have prioritized access to services, it just really seemed like a really targeted focus. And I am thrilled, I think, as again, some of the other committee members have said, kind of where the legislature has stepped up and where advocates have stepped in to bring forth proposals that maybe mitigate some of that, as we really work to, we want to see that increased access to home and community-based services. So there's that. And then I think just, acknowledging again how important our immigrant population is here in California, in general, just as people and the contributions, but also to our long-term care service system. And that if we really do want to build that strong, equitable system of health and aging, we also need to stand strong with those who are supporting that system of care, and really understanding the concerns and the fears and the threats that they're experiencing, and how to be, I think, stepping in as allies. So I appreciate this opportunity to have this moment to discuss these concerns, and actually really appreciate everyone's vulnerability here today to talk about, I think, the fears that we're all experiencing, the anxieties that we're all experiencing, and also find hope in knowing that we can come together to discuss these things, knowing that we're all in our own different spaces, trying to engage our communities to make them stronger, and hope that we continue to work on this as we move forward. Thank you.
Thank you, Megan, so much. Kathleen.
Yeah, I just want to echo the comments here and to say that through the California Caregiver Resource Centers, we've made it a point to make sure that all of our family clients are informed about possible changes and changes in policy, both on the state and the federal level, and to enable them to give voice to their concerns to wherever that is appropriate to be directed to. I just want to do a shout out to to the Justice and Aging folks. You guys have been complete OGs about bringing the information as soon as it happens, interpreted in ways that regular people can understand. We use it and turn it around to inform our clients in our programs. So you guys have just been really stellar, and I just wanted to give a special shout out to you.
Kathleen? Appreciate it. Barbara?
Hi there. Not only has all of the concerns that's been expressed by everybody affecting participants, it's affecting the caregivers as well, to the point where we're concerned even at our own agency, where we have people that, we do our checks, but they're expressing to us that they're here legally, but they haven't heard about their renewal of their processes in order to continue to work. And so I'm really concerned, and I think it's another argument that we could discuss with our elected officials about the workforce, the impact on skilled nursing facilities, home health agencies, IHSS. Even if one member of let's say an IHSS family has been taken away by ICE, it's disruptive to that entire family and they may need to move. And therefore, we're now impacting our workforce. So this has such strong implications. And with the wages and the effects of everything that's going on, this is bigger than just, taking care of people or basically having concerns that people are on our programs receiving services. There are also people that are receiving services because they have caregivers that are in this situation of, work and background. So we have staff that have expressed to us they don't know what they're going to do. And so that disrupts what we're doing with staffing. And so I just want to make that comment.
Thank you, Barbara. It's very important for everyone to be aware of the snowballing effects of many of these cuts and decisions and how they're impacting families in our communities, especially immigrant families. Anyone else on the DACLAC committee have a comment you'd like to make before we move to our next agenda item? Again, for the public who is attending the meeting, we will have a public comment period in about 10 minutes. So please hold on to your thoughts and what you'd like to share then. Okay, well, I think I'd like to just wrap up by reminding us, Janie said it earlier, how effective our advocacy efforts were in making some significant changes between the governor's May revise and what the legislature, both the Assembly and Senate, has come back with changes to the proposed budget. A lot of the very, very drastic cuts that would affect our poorer community members, including many older adults who are on fixed income and people with disabilities who are also on fixed income, who rely on Medicaid services, not only the healthcare benefits, but all of the other support services that come under Medicaid, how they would be so severely impacted. And it would result with some of these severe cuts in loss of independence. We would see more people having to rely on going into nursing homes and whatnot. So we're really appreciative of everyone's advocacy efforts at the state level. Keep it up. We want to make sure that the legislature and governor still understand how important these services are to members of our community. But also as a reminder of how effective we can be in coming together. So please consider staying in touch with your members of Congress, letting them know what you're supporting and not supporting, what you're opposed to, as well as our senators with regards to the budget bill. So now I'm going to turn it back over to, I don't know, Hagar, are you turning it over to Susan?
Turning it to me and I'm turning it to Susan.
Okay.
Good morning. I'm sorry to interrupt you. This is ASL interpreter. Could you please co-host me again?
Yes, we will co-host
Thank you so
Summer.
much.
Thank you. And Sherry and Hagar, thank you so much for creating that space, and to all of you who shared your thoughts and feelings and fears. It's growing tiresome to make this space at each of our meetings. But I'm just so grateful for all of you. And as Megan said, thank you for being vulnerable. It's now we're fortunate we can switch to a bit of positive news, and I want to extend a very special welcome to Director Michelle Boss, who's bringing us an update on the progress being made in CalAIM, a report out from the Department of Healthcare Services. And I know for a fact that many of you on DACLAC and joining as public members have contributed to the successful outcomes that we're about to hear from. Director Boss, thank you so much for joining us.
Thank you so much for the invitation to be here and just to share some good news regarding community supports, especially in these times and challenges up ahead. But as you know, community supports is one of the key features of CalAIM, and these are services provided by our Medi-Cal managed care plans to help members live healthier lives and avoid higher, costlier levels of care like inpatient or emergency department usage. These are services that address the health-related social needs of our members. Community support started in January of 2022, and all of our managed care plans are phasing in up to 14 community supports. Recently, we submitted our annual report to CMS, the federal government, analyzing 12 of the community supports that are authorized under the 1915B waiver. And this analysis is for information for calendar year 2023. Some of the key highlights, managed care plans in all 58 counties offer community support, so really significant growth from January 2022 to now. 12 managed care plans across 23 counties offer all 14 community supports, and all managed care plans statewide offer at least 8 services. Across these community supports, more than 494,000 services were delivered to more than 250,000 Medi-Cal members in 2024. And one of the premises of community supports and kind of the authority by which we propose these is that Medicaid rules allow certain regular services to be replaced with more cost-effective community-based options like community supports, as long as they are, again, appropriate for our members' health needs and meet standards, but also under the waiver, really, we need to kind of demonstrate to CMS the cost effectiveness of these different services. As part of the report, we analyze both the direct cost for community supports and the associated healthcare savings. And we demonstrated that 9 out of the 12 services are already cost effective within the study period. And the remaining 3 are projected to be cost effective over a longer study period. So really demonstrating the value of these services, both in terms of members' needs and the cost effectiveness of these services. To give a little bit more details, what we mean by cost effectiveness, housing deposits, for example, were associated with a 31.6% net reduction in cost, rehabilitation, a 17.1% reduction, sobering centers, an 11.7% reduction, respite services, 61.3% net reduction. And so, for example, members who used at least one of the housing trio community support, so this is either housing transition navigation services, housing deposits, and housing tenancy and sustaining services, had a reduced inpatient use of 24.3%, a reduced use of emergency departments, 13.2%. And so really some really concrete data points to demonstrate the effectiveness of these services. Another example is the medically tailored meals and medically supportive food community supports associated with reduction in inpatient use by 21.4% and emergency department reduction of 22%. We also know that some of the services such as the assisted living facility transition and community or home transition services have been instrumental in offering cost-effective alternatives to institutional care and really providing services to reduce avoidable hospitalization and long-term care admissions. This positive impact is expected to increase. This is the first year that we were able to prove with the data the cost effectiveness and net reduction in some of the more expensive spends of services, and we're really recognizing the improved outcomes for our members and really in terms of just addressing their health and real well-being and meeting members where there are, really demonstrating this with this report. We know that there is still much to do across the state to continue to build out community support so that all members have access to them no matter where they live in the state. But really, this report helps us demonstrate kind of the theory of the case by adding these health-related social needs to the Medi-Cal program, how we can really improve our members' well-being. And we think this is really particularly important as we think about the renewal of our waivers with the federal government, really having concrete data to show the effectiveness of these services, concrete numbers that we can point to prove that it's valuable to continue these, as part of our next waiver. So wanted to share that. Thanks again, Director Morris, for inviting us to share this information. We're very, very excited about this information because it really helps us prove the case and demonstrate to the country really what we can do as we think about health-related social needs and how they really can address a member's entire well-being. So I don't know if
That's fantastic, Director Boss. We're so grateful that you could join us today and bring a bit of good news. And for many who are joining us, CalAIM is just still getting off the ground, and the 14 community supports. And look at you already producing evidence that benefits us all, benefits the state of California, and just another place where California leads. We appreciate you joining us. You have at least 2 representatives with us today, Joseph Billingsley and Anastasia Dodson, who are with us for the duration. So any other thoughts, final thoughts from you?
Just take 1 minute to recognize Anastasia Dotson. This may be her last DACLAC meeting as she is retiring. I think many of you may know that. And I just wanted to take a minute to recognize her just dedication to kind of the long-term services and support space, really all the work on the master plan on aging and everything she's done here at the department, the Office of Medicare Innovation and Integration. She was also instrumental in the Affordable Care Act and the expansion of Medicaid to adults. And so just a tremendous public servant. She's been with the state, I think, about 18 years. I think that's about right. But just, I wanted to take a minute in this space to recognize her. So thank you.
Thank you. It's been a great opportunity. Thank you to everyone.
Thank you for adding that, and we'll celebrate you the rest of the meeting. And you are a tremendous public servant and a champion for older adults and people with disabilities. In your current role and the other roles that you've held, we're so glad to have you with us for this meeting. Thank you for adding those kind remarks, Director Boss. And you're excused now. Thanks.
Thank you very
much. All right, now I'll turn it back to our
Before
committee co-chairs.
Director Bass goes, can I ask her a question? This is Barbara Hanna.
Barbara, she's already signed off.
I see that she's still there. And so
questions during this segment.
It's related to a barrier for getting additional providers enrolled into certain segments of community supports, specifically asthma remediation. The methodology is through the PAVE process. There's a PAVE portal that's being utilized for asthma remediation. Other providers that are already Medi-Cal providers are enrolled in Medi-Cal, and the only way PAVE can be utilized is if you're a nonprofit. And so there are other providers that are capable of providing, for example, asthma remediation, that there's no method for me to get into that process to provide services. And I'd like to bring that to Director Bass's attention because I believe that having no wrong door and all providers, there's enough sick people, there's enough asthma, there's enough services and providers that if we provide access to these services, regardless of your tax status, utilizing Medi-Cal, it would be beneficial to the state. And so to me, that's a barrier, Director Bass, and I think it's a misunderstanding between when people set policy and understanding how the billing works. There's different codes that are used for different provider types. And so that's the problem. And I would love to talk offline with some more about these issues so that we could maybe resolve that.
Barbara, thank you. Oh, Anastasia, if you'd like to comment. Thank
Sure,
you.
no, Joseph and I are here. We're taking notes. And Barbara, I don't know if we have your email, but probably if you can put it in the chat, or I'll.
Yeah, Joseph does. Thank you.
Okay, thanks.
And now Carol is going to move to our public comment period. I see some of our committee members do have their hands raised, but we'll make sure there's ample time for those questions from committee members after Carol takes public comment.
Hi, thank you for waiting. This is our public comment period. For those of our attendees wish to leave a verbal comment, please either hit *9 if you're on the phone or your Zoom webinar raised hand icon. And I see that Jeffrey has his hand up. Jeffrey, you may leave a comment. Jeffrey, I believe you're unmuted.
Here at RIL, with either the recipient of IHSS or the care provider of that recipient are unable to get through to the social worker on the.
Can you hear me?
Yes, go ahead, Jeffrey. Yep.
Okay,
Go
I'm
ahead.
sorry. I'm also in a dogfight meeting at Resource Independent Living, but my trying to listen to you and also the other thing through there. What is going on? Because should we say, Master Plan of Age has lost Kim McCoy Wade. Was that brought up in any of the forums of discussion, as well as some of the other issues and things of that nature going on? Just a question.
Public comment, we do not take questions or respond to them, but I'm assuming that we are going to take your question as a statement and we will take it back. Is that a fair assessment?
Thank you. I will go back to the.
I'm sorry, Jeffrey, you seem to be breaking up.
On your closed captioning, say in the last.
I'm sorry, Jeffrey. I couldn't hear that. Your transmission is not great.
I'm in a basement area level.
I believe we heard your question to be, since Kim McCoy Wade has left, whether that position will be refilled, and we can take that back and note it. Okay. Any other questions from the public?
Carol, Yolanda Whittington has her hand raised.
Okay, thank you. Go ahead, Yolanda.
Yes, thank you. Good morning. Hopefully you can hear me.
We can. Go ahead.
Great, thank you. My statement is, I'm hoping that CDA will put forth a plan in the event that our RCFEs are discontinued for our Medi-Cal recipients due to the plan cuts. Thank you.
Thank you, Yolanda. Your comment has been noted. Any other comments from our public participants? Do want to remind you that at any time you can send your written comments to our Engage email box at engage@aging.ca.gov. We will have an additional public comment period towards the end of the agenda. So you are encouraged to give your comment at that time, or of course, anytime to our Engage email box. Hagar.
Yeah, do you mind if we open it up for 2 minutes I think we have 3 minutes on the agenda. So if you don't mind, maybe if panelists have some comments as well, we can take a couple. Is that all right?
Sounds good. Let's take the slide down.
I
And we
see
have
Debbie.
Debbie.
Oh, sorry. I'm going to go on mute now.
Go ahead, Debbie.
Great, thank you. Hi, everybody. Debbie Toth again from Choice and Aging. I just wanted to recognize Director Boss, Director DeMorris, and all of the other directors that have been having to appear in these hearings and present cuts and things that I know in their heart of hearts they don't agree with. And I cannot imagine how it is to have to present this information. And I could not be more confident and comfortable with the leadership that has been appointed to the various different departments. And I know I say that a lot, but I truly mean it. And it's important for us to recognize that we haven't had this kind of leadership historically, and this is an ugly and a hard time, but we have the right women, in most cases, women in the right places. And I'm extremely grateful for that. And I also want to give a shout out to Anastasia, who has been, I will say, voluntold to help me with every single thing I don't know how to navigate at DHCS. And I don't know what I'm going to do without her. She is brilliant. Her mind is the most incredible spreadsheet you could ever imagine, the amount of knowledge that is in there. And it's going to be a huge loss to DHCS. And I think it'll take 5 humans to cover the amount of information and knowledge and breadth that she has. And I just, Anastasia, wish you all the happiness in the world and appreciate everything you've done for all of us, for state work, but individually for many of us. So thank you. That's it.
Thanks, Debbie. Right back at you, and to all of you. Thank you.
Looks like we have no other comments. So I think, Carol, we can move right on to break. Defer to you to announce the break. All right, we'll take a 15-minute break. We'll see you very soon at, Carol, 11:19, 11:20.
11:20. Let's do 11:20.
All right.
All right. Thank you all.
You all had a good break and got a snack, and we are going to now turn to Susan Demeroy, the Director of the Department of Aging.
Thank you, Hagar, and welcome back, everyone. I have just a few announcements I want to make to share with the group. First, I want to thank and acknowledge our many state colleagues who are joining us today. It's not always apparent to everyone on the call. We have 3 directors. You've already heard from the director of the Department of Rehabilitation, Kim Rutledge, who is joined by Dante Allen, who you were introduced to earlier. We heard from Director Michelle Boss, who leads the Department of Healthcare Services. She's joined by Anastasia Dotson, who we got to see on screen and you'll hear from, as well as Joseph Billingsley. We have the Department of Developmental Services Director Pete Cervenka joining us, as well as Allison Giannini on his staff. Allison Joe with the California State Transportation Agency, CALSTA, is with us, as well as Liz Fuller, who represents the Assembly Aging and Long-Term Care Committee. Thank you all for joining, and I apologize if I missed anyone. We're glad you're here as well. Oh, I did miss somebody, Claire Ramsey, who is with us from the Department of Social Services. Claire, thank you so much for being here. The announcements that I wanted to make, we have a few things upcoming. Sunday, as you may know, is World Elder Abuse Awareness Day. I want to thank all of you joining who have events and activities planned in your communities. And I want to note, for those who don't know, we have an Elder and Disability Justice Coordinating Council that meets regularly, and that is where issues of elder abuse and neglect and exploitation, where we focus through that committee. And they have a meeting upcoming as well. June is Pride Month, and we're proud that on Monday we are hosting a webinar. The link will be in the chat. You're all invited to join. We're very excited to be hearing from Senator John Laird, who we're so pleased. Many of you know that we led a research study and survey that where we heard from over 4,000 older adults in California. The LGBTQIA plus survey and report that was released last year. That was an impetus for the state legislature to form a new Senate Select Committee on older LGBTQ adults, and Senator John Laird is the chair of that group. He'll be joining us on Monday, as well as a diverse panel of speakers and presenters. We really want to put a spotlight on the survey results and outcomes, as well as hear what's going on the ground with the community today. So we'll be hearing about what's happening in skilled nursing facilities, residential care facilities for the elderly, assisted living communities, and in the community. So please join if you're able to. Also wanted to share that we're in the process right now of updating California's state plan on aging, not to be confused with the master plan for aging. This is something that the State Unit on Aging, which is California Department of Aging, we're responsible for doing this every 4 years. It is due to the federal government July 1st. And this is focused narrowly on our Older Americans Act funding. So all of the programs that are supported by the federal Older Americans Act, delivered primarily through our 33 area agencies on aging, as well as our health insurance counseling and advocacy programs and our long-term care ombudsman programs around the state. We held a public hearing in East Los Angeles last week. We also held a public webinar. I see some familiar faces. And we held a webinar for our tribal partners. We're now collecting input, and the cutoff date is June 21st. So any of you joining today can provide public comment through our website, and the link is available in the chat. We will take in all of that public comment, integrate it where we can, and we will update and submit that July 1st to the federal government. This plan is key to unlocking about $200 million annually that we distribute to our network. So it's very important that we submit this on time, July 1st, and that it's approved by the current administration so that we can get those dollars out to our local networks. I think that's, and it represents the 4-year 2025 through 2029 consequential years for older adults, people with disabilities, and family caregivers. And then last, I wanted to note that CDA had a recent promotion we're very excited about. The governor recently appointed Connie Nakano to serve as the Assistant Director of the Office of Strategic Initiatives and Equity at the California Department of Aging. Connie is an outstanding member of our leadership team. We're thrilled she had this promotion. She leads all of our external facing work, our aging resource guide, our disaster planning guide. Her commitment to equity is deep and strong. We can credit Connie for having all of our materials available and translated in at least 7 languages. And she's just a wonderful addition to our executive team. And she'll pull together the state plan on aging, the master plan for aging, and our own department strategic plan. And last but not least, a big bit of good news. Just last week, we were awarded a federal grant by the Administration for Community Living, a 2-year grant to help explore the use of community health workers in the assistance, information, referral, and navigation space. So we're thrilled that the Federal Administration for Community Living awarded us these competitive funds. We're excited to get started on that, and you'll be hearing more more about that. But we're thrilled, and my thanks to our team at CDA, led by Sarah Steenhausen, who pulled that competitive grant application together, so that California could be awarded these resources that we will put to immediate use. And that concludes all of my updates, Hagar, and I'm happy to be with you for the remainder of the meeting.
That's wonderful. Thank you. And I'm actually going to turn it to Sherry, who will introduce our subcommittee discussions. Hi, Sherry.
Hi, welcome back, everyone. Thank you, Agar. Thank you, Director DeMorris. Yeah, so now this for the rest of our meeting, we will be able to hear from our subcommittees. As you know, we have 3 active subcommittees: Home and Community-Based Services, Housing, and Transportation. And actually, I'm going to send it right back to you, Agar, because you are the chair of the HCBS subcommittee, and I think you're kicking us off.
Just ping pong over here.
Yes.
Great, thank you. So the HCBS, or the Home and Community-Based Services Subcommittee, has been talking about the Department of Healthcare Services plans to move home and community-based services waivers into managed care. And we had a meeting with Department of Healthcare Services a couple of months ago, I believe, about some of our recommendations and lessons learned from the from CCI demonstration, or the California Coordinated Care Initiative demonstration, that took place a few years ago. So we will present a little bit of more of the high-level recommendations and core values that we've identified as a committee. And Megan Burke is actually going to lead this discussion with participation from the HCBS subcommittee. So I'll turn it to you, Megan, if you're there. I hope you're here.
Yep, I'm here. Thank you, Hagar. And I don't know if I need to share my slides or if the what we turned in will be shared. So sorry, just wanted to.
I think Carol, are you able to share the slides, or Rosie?
We do have the slides, so
Oh, perfect.
Momentarily, I'm sure we will get them.
Perfect. Thank you. So thank you, Hagar. And as Hagar noted, our HCBS subcommittee spent this time reviewing kind of past carbon of home and community-based services, those past experiences and processes, and have developed the recommendations I'm going to share with you all as it relates to Department of Healthcare Services HCBS waiver transition. And our feedback really stems from, again, some of the evaluations of previous carbon experiences, but I think the lived experiences and the policy and program expertise of our subcommittee members as well. And the subcommittee's recommendations are rooted in the experience of individuals being served and how to improve that experience and strengthen access to services. We've identified 3 focus areas or themes, that being the seamless access and person-centered services, quality oversight and transparency, and reduction in unmet needs and network adequacy. So next slide. So with regard to seamless access and person-centered services, we recommend that Department of Healthcare Services conduct a robust outreach and education to individuals as well as the provider network about the available waiver services and how to access them. I think for individuals, it's about understanding what is available and where to access services, especially through this transition. And then for the provider network, it's kind of that age-old need of building awareness of the services and expertise that's available in the community to support consumer goals. Our second recommendation, we see the opportunity to reduce administrative and navigation complexities while implementing person-centered processes that support the home and community-based service access. And as this means creating those systems and processes where a case manager garners that input from the person on their goals and knows how to elicit additional information and share information to help an individual make an informed choice. We also ask that Department of Healthcare Services require health plans to establish clear communication pathways that allow an individual to coordinate their services with one single person. This means having that one trusted person who knows the landscape of services, can clearly explain what's available as far as the choices and really those pros and cons of the choices, and has the authority to develop and support implementation of a service plan. I'd also like to see the development of parameters for bidirectional data sharing between health plans and community-based organizations to ensure the seamless and timely service delivery and reduce that burden on individuals to continue to provide repetitive information. To further expand on these recommendations, I'd actually like to turn to a couple of our subcommittee members. First, Corinne Jones, if you could offer kind of the CBO perspective on kind of what seamless access and person-centered services really means. And then we'll turn to Michelle Rousey just to share that consumer insights regarding the importance of the outreach. So Corinne, are you available?
I am. Thank you so much, Megan. I would like to just add, especially right here where we're talking about seamless access, that it is extremely important that we remain vigilant to ensure that the whole person, the person-centered ideals, are the guiding principles for recommendations on behalf of our clients and the individuals that we're trying to serve. There are many HCBS options. There's PACE, there's MSSP, there's CalAIM, etc. And the recommendations for what is the best door, the correct one, must make the person being helped, not the funding source or the data mark, but the person being helped, make them the main logic for the chosen recommendation. Thank you.
Thank you, Corinne, for adding some additional detail and color. I really appreciate it. Michelle, I know you wanted to share again kind of the perspective on and consumer insights regarding robust outreach.
Yeah, just a second. I'm trying to pull it up, and it's just okay. Here we go. We talked about learned experiences from Tabby. Stop. Sorry, Tabby. Stop. Sorry, guys. I've lost it, but give me 1 second. Come on, computer. Okay, here we go. We learned about the experiences from IHSS carved into managed care during CCI, and it was underutilized because people didn't know about it. It's not that people didn't need it, but people can't use what they don't know about. And when you transition from one program delivery to another, you need clear communication, especially with those who need the services the most. And then have follow-up to hear their concerns and the gaps in services that they have. Need both consumer outreach for feedback and assessment, opportunities for grievances and follow-up. Make sure there is a clear understanding from the consumer side and also from the provider or the plan side. It's overwhelming to manage your own care needs a lot of times. And so consumers, if they are reaching out to the different avenues, having no wrong door is important, and them being able to be referred or get services in a timely manner is important. Thank you.
Thank you, Michelle. Always appreciate your input and insight, especially as you've have that lived experience of navigating these systems. So appreciate that. Next slide. So next is quality oversight and transparency. And I think when responsibility for oversight and delivery of services is transitioned from the state to a non-government entity like a health plan, can really cause concern and anxiety about the risk of unmet needs, as accountability structures aren't always as clear. So as such, we recommend that the state clearly define the objectives, measures of success, and scope of responsibility of the health plans for providing home and community-based services. Also, they establish standards for third-party delegation that support transparency, data collection for oversight purposes, and accountable grievance processes. So they ensure the state has timely access to home and community-based services data from the health plans to report on identified need, referrals, as well as access to those services, even if the services are delegated. And then to develop processes to ensure that the health plans and subcontractors comply with the setting rules and other HCBS consumer protections. We also have to implement a structure for a consumer feedback loop to strengthen service delivery and oversight. And we recognize the Department of Healthcare Services has a stakeholder work group advising on the roadmap, but it's equally important to have that consumer advisory group to provide feedback during the transition, to get that lens into how things are going from, I think, the person experiencing those services. And on that note, I actually wanted to turn to Andrea Roberts, who so eloquently brought the idea forward to our subcommittee. So I'd like to give her an opportunity to kind of share her thoughts and kind of build out this one bullet. Andrea?
Hello, everybody. Again, I may have to unmute myself because I live right next to the MetroLink train. So again, it would be ideal to form a separate committee that include consumers as advocate in all phases of setting up this work group, meaning that there's really no group that help with oversight committees in regards to a consumer perspective. And so we have these great groups that's going on. They're already established, like the stakeholders, the advisory committees, and then also subcommittees, but there's not really a committee that also have consumers that can help with oversights, quality, and transparency. Also to provide consumers a way to track changes and address concerns. And why is this important? A lot of time as consumers, we know the changes that are necessary. Also, it would be helpful to offer assistance to provider to help them implement changes that's going to better provide a quality of life while folks are in these programs. And then also just keep in mind that when we are forming these groups and people bring concerns to these groups, I'm at the we have to make sure we safeguard the consumer and the family member, because sometimes when they bring complaints to committees, sometimes the outcome is not always great for them. And then also these consumers are also aware of what assistance that is needed. Sometimes families are not certain about help that's available. And then also, they are not informed about all their benefits. So sometimes they have benefits and, things that they qualify for or that are available to them, and they're not always, available to them. And then also my final point would be, we need representatives like myself to serve on committees to make sure we're dedicated to the oversights, who advocates will assist in acting on behalf of them. So my biggest point is that there's really no oversight committees that have consumers and advocates like myself that can make sure that these policy and procedures are followed, and then also that they're looking out for the best interest of consumers. So I'm just hoping with all these established committees right now, if they would consider adding a committee for oversight that consumers like myself and others can sit on to make sure that the goals and policies are realistic to the folks that need them. Thank you.
Thank you, Andrea. And then Corinne, I had a note that maybe you had something else you wanted to share to build onto this section, and just wanted to give you that opportunity. And if not, we can move on.
I'm sorry, I didn't hear you.
Oh, Corinne, I had note that maybe you had something else to add on to this section around quality and oversight, transparency. So I wanted to give you that opportunity if you had something additional to say. Otherwise, we can move on to the next section.
We can move on.
Okay, great. Thank you. So next slide.
Wait, I'm sorry, Megan, I'm sorry to interrupt. I do want to note that I found on the DHCS, I saw an announcement of their Medi-Cal stakeholder. It's part of their comprehensive quality strategy, and they have this council that they're now accepting applications for. Joseph, is there anything you could say about that? Because it kind of responds to what Andrea was just talking about.
No, thank you, Sarah, for highlighting that. I think that definitely if individuals have interest in participating in that council and need more information, please reach out. We're happy to provide additional information. And then
I put the link up.
Appreciate that.
Link is on the chat. Yep.
Can I make a quick comment on that? So yes, you're right. There's several committees that are established or being established, but there's really no oversight committee. And so I have participated as a stakeholder, an advisor, and I've also participated in subcommittees. But in a lot of cases, we don't really have the opportunity to help and advocate in regards to oversights. So you're right. There are committees in place now, but there's no standalone subcommittees or oversight. And I think that would be nice to add or to form, as well as the committees that's already in existing. And this is something that I've been advocating for as long as I've been sitting on committees. There's just usually not enough time within the committee to address oversight or transparency on the behalf of the consumer.
I could appreciate that, Andrea, and appreciate kind of speaking up to define a little bit more as to kind of what you were thinking. And I think, to Joseph, always appreciate the state. I mean, we're sitting here on the DACLAC committee, right? It's one more opportunity for stakeholder engagement. And I feel like Department of Healthcare Services has created a number of opportunities for stakeholders to engage in different ways. But I think hearing Andrea speak, it's, thinking about, that oversight and what that engagement really looks like. So kind of like, what is on those agendas and what does it mean? I know when we talked as a group too, it was kind of like, there's processes in place for people to, individuals, to appeal when there's been a denial or to report if there's a concern with the service, but sometimes doing that as an individual there's a need, but it can also be a little overwhelming. And so there's like that individual level, but then how do we kind of collect those and as a group, so no one person is put on the spot, have stakeholders be able to come together and speak from their experiences to address issues that continue to bubble up. And so just appreciate some of these different mechanisms that have been set up for stakeholders to engage, but encourage the state to think about how stakeholders are engaged in those meetings and on the topics in different ways, I think. Okay, and then our final slide, if you don't mind, we can change to, yes, the reduction in unmet needs and network adequacy. So finding ways to develop, we've I think as a state have worked pretty hard on the improving kind of the assessment process to identify need, but there's always room for growth, but also ways to reassess or understand what some of those reassessment triggers are to ensure that folks have the right level of services that align with their needs. as things change, right? So it's not just like on a calendar, but are there triggers that we can put in place for that reassessment? Thinking about the implementation of a robust network adequacy standards for CBAS and other home and community-based service waiver services. And then requiring plans to contract with HCBS providers that have proven expertise in delivering specialized services and understanding population needs, and building on that, ensuring that that network includes those providers that are trusted and have experience engaging with underserved communities. And so I think there is concern that, that balance of the requirements and flexibilities for the health plans who they contract with to provide these waiver services, knowing that there is a robust network of folks who have worked with identified populations, have that specialized knowledge of the services and the understanding of the populations, and not wanting to lose that. So thinking about, again, how we require plans to contract with those knowledgeable and experienced providers. And I think continued efforts, as the state has done, to support those providers and being able to work on those contracts and contract with the plans. And then I wanted to turn real quick to Barbara Hanna, who had some additional insights to share from the provider perspective regarding kind of that operationalizing of the programs and the services that are covered within the payment rates that impact network adequacy. So Barbara, if you're available to kind of share your thoughts that we had discussed before.
Yes, thank you.
Mm-hmm.
I think the slide starts to speak to some of the comments that I've actually discussed. Talking about robust networks, it really, depending upon the communities, like I serve primarily rural areas, although we are based in Sacramento as well. And when you look at the different communities, there's all types of organizations that grassroots, corporations, limited liability companies. And if you were to ask me, how do I define myself? I define myself as a community-based organization because we've been embedded in the community for over 45 years, providing services to people that are Medi-Cal, HIV and AIDS, under patients that have had complex disease processes and that have been traditionally shunned by maybe the traditional medical providers. And what I'm seeing, and part of what I talked about earlier with Director Bass, was some of the barriers that exist in trying to get this broad-based, any willing provider that is knowledgeable, that has been in the community, to be able to provide services and to break down those barriers. I think it's really important that there are caregivers also that are in these committees that help take care of these patients or these participants that we're caring for. Because without those caregivers, we could not do the work that we're doing. And I think that becomes so essential, that this network and the adequacy of it also has a mechanism for feedback. We all know right now that for waiver personal care services, there's been difficulty in getting those individuals processed timely so that they're getting paid, so that caregivers are not leaving taking care of their participants because of lack of pay or timely pay. So I think that from a provider standpoint, it really should be any willing and able caregiver that's been able to provide services for Medi-Cal. And I would love to look at the different, when you speak to the health plans, those are some of the concerns that we have is that how do they identify who's in the community? Are they going to just select one entity to contract with, thereby leaving out a whole group of other entities that are possible to provide those services and therefore not having client choice? So I think that is basically what I have to say regarding this. And I really would support that the networks are not only in, again, definitions. I put in the comments, just recently, the health plans decided to define a community-based organization as a nonprofit entity. Well, there are community-based organizations that have other mechanisms besides the 501c3. And so I really think we need to stop looking at the tax implications, and we need to look more about what does that entity provide to the participants in the community, and what specialties do they have that they can provide. So I don't know if anyone has questions.
Thank you, Barbara. I see that we have like a couple minutes left in our section. So yeah, so if there's any questions with regard to some of the recommendations we brought forward, or Hagar, if you wanted to facilitate, if any of the subcommittee members had a brief statement to make in addition to what we've shared.
Sure, we can open it up for comments, both from the subcommittee and general DACLAC committee members, and then if anyone from DHCS wanted to participate or respond or have some input, please feel free to engage. I see Sylvia, you're on.
Thank you, Hagar, and thank you, Megan, for this presentation. I guess I just wanted to augment what Andrea is saying about a consumer presence to be involved in sort of oversight and transparency. I do think that many consumers are experiencing gaps or issues that they don't bring to the level of a grievance. It's a whole thing to raise a grievance, to officially file a grievance, and the complexity of many of these consumers' lives makes it difficult to do in the first place. But also, there's not necessarily this awareness that it's a combination of things. Life is moving. Your niece is an unofficial caregiver, moves away, gets a job somewhere else. You twist your ankle. Things are moving, and then there is a gap. You're not getting the level of care that you need, and it doesn't seem like a systemic issue, but the failure to recognize something like that, or to know where to go for assistance during a period of transition, or because one's needs have just grown, is a systemic issue. So the more that we can really link what consumers experience with the mechanisms that we use to oversee and hold plans accountable, the better. There just really needs to be that strong link between to ensure that the HCBS users in the community are actually getting what they need over time. Thank you.
Corinne?
Thank you. I was so distracted reading this Medi-Cal Voices and Vision Council until I remember it made me click with what it was I was going to say, which is that I think that, and it's much like what Sylvia has said and Andrea has already said, that there needs to be a consumer advocacy committee. That's what I was calling it. Consumer advocacy committee for HCBS issues. And it would be, which is much like, I guess, what's being described as the Voices and Vision Council, the opportunity just for older adults or users of the services to have someone to be their voice is all I'm advocating for. And so if it's more formalized, though, where there's a structure to the meetings and what have you, there's reports and things that people can read and input to, I think it'd be more effective. So that was just the other little comment that I wanted to make as far as quality and oversight transparency, that there be a consumer advocacy committee, and this Medi-Cal Voices and Visions Council could be the answer.
Thank you, Corinne. Andrea?
Mommy, give me a second. I'm getting ready to get online. Sorry about that. So yes, you guys, especially the agency, please understand that a lot of time, this is the only time we can raise our voice in regards to what matters to us as consumers. We meet every 3 months, and the other time I hear concerns and complaints by people that's receiving these services. So I feel my job is to bring this information to you all. It's not to tell folks what to do, but it's to bring a voice to what's important to consumers. A lot of times consumers and family members don't have anywhere to go in regards to their concern. So we really need an oversight committee to make sure and to ensure that what is being suggested is being carried out, because we don't know that. We don't know if people have concerns, but then the concerns are not being addressed. And so I feel my job is to make sure, since I have this platform, to bring it to the attention of others so that I can work and we can work in partnership with each other. And so this is really important for us to have this platform. And a lot of folks that look like me don't have this platform. And so I am urging you guys to consider having an oversight committee so that we can address the concern of the consumers. And thank you so much.
Thank you, Andrea. Do we have anything else? I think Michelle wanted to speak, and then I see that Anastasia. Anastasia, why don't you go first, and then we'll hear from Michelle.
Okay, I just want to be realistic about this. The Voices and Vision Council is across all parts of Medi-Cal, all ages. So I just don't want people to be assuming that it's only going to be focused on HCBS. Just, that's because, and it's part of the establishment of that is related to Medicaid regulations. But we definitely hear you about wanting more venues for consumer advocacy for HCBS, and Joseph is the lead there, but we'll take it back. We'll talk with our director about it. Thank you.
Thank you. Appreciate it. Joseph, did you want to weigh in as well?
Yes. No, thank you for the opportunity. One, I just wanted to thank you and highlight like the work you put into preparing this the presentation you just went over, and really thinking about what are lessons learned from previous transitions, and what are key goals or strategies that you think the department should focus on when as we're going through the process of planning and preparing for HCBS integration into managed care. I think it really resonates with a lot of the things that the concepts and goals that we've been highlighting in the current stakeholder work group process that we've established to inform like the policy development and concept development for how that how we're going to approach the integration. And I know we have some members of DACLAC here today that are involved in that stakeholder work group. And so I would appreciate, I was checking, I don't know where the slides are, but if those are able to be shared, I'd like to take those back so that we can make sure that we're building those concepts into the stakeholder work group meetings and what the different topics we've been bringing up for discussion and stakeholder feedback there. So that would be really beneficial to align, make sure we're fully getting input from all of our various stakeholders, and then yes, also to Anastasia's point, highlighting where there are existing opportunities for stakeholder feedback, but then also taking back, your input and suggestions around where there could be additional, support provided through something like a consumer advisory board. So thank you.
Thank you. And I think we'll take one more quick comment from Michelle, and then we're eating into the transportation subcommittee's time, so we'll move on. So we'll take one more comment.
Is transportation or housing next? I thought housing was next.
Housing is next, Michelle.
Oh,
But,
sorry. I'm
yeah,
sorry.
that's okay. So if you have a quick comment, and then we'll move on to the housing subcommittee report. Thank you.
Don't scare me. Um, anyway, yeah, I agree. There needs to be a consumer oversight, and I hope that Medi-Cal group considers having somebody who is a dual on their advisory committee also, because although they are not fully covered by Medi-Cal, they are covered by Medi-Cal, and that impacts that population also. So I would hope that they would include having somebody who is a dual. Thank you.
Great, thank you so much. And thank you for everyone's participation. And now we're going to move on to the Housing Subcommittee, which is led by Lauren Cardin and Corinne Jones. Lauren is from Justice and Aging, and Corinne Jones, you guys can, from Senior Network Services. And so you guys can go ahead, please, and start your presentation. Thank you.
Hey, thank you, Hagar. So yeah, just to introduce myself, I'm Lauren Cardin. I'm the Director of California Housing Advocacy at Justice and Aging, and just recently joined DACLAC as co-chair of the Housing Subcommittee. So today, the Housing Subcommittee wanted to discuss some of our priorities that were highlighted in the legislative cycle and the legislature's budget, and also just address some concerns about implementation of our priorities in light of the state and federal budget issues. So I'm going to go through these by initiatives, and I apologize we don't have slides due to a lot of this information coming out earlier this week. Some of the issues I'm going to discuss were also touched on earlier by Sherry and Hagar, but we're going to dive a little deeper into the housing specific issues. And then Corinne will jump in after I've gone through these. So first, just starting with Initiative 1. So just as a reminder, Initiative 1 lists the goal of protecting housing supply, housing assistance, and housing supports through coordination at all levels of government. So we are recommending that the state support continued investment in affordable housing programs and production and homelessness prevention programs. We applaud the legislature's version of the budget, which calls for $500 million in supplemental state low-income housing tax credit or LIHTC program funding, and $120 million to the multifamily housing program, and $500 million for the Homeless Housing Assistance and Prevention Grant, or HAP, Round 7. These programs really help fund a majority of the affordable housing projects in California, and it would be really devastating to lose them. And I think, as we all know, the housing crisis is not going to go away by investing less in solutions. So we were really heartened to see that the legislature understands this. And kind of on the other side, we were disappointed that the May revise had no mention of LIHTC program funding, multifamily housing program funding, no additional funding for HAP, and actually had cuts to funding for the Affordable Housing and Sustainable Communities program, which is also another source of funding for affordable housing. So we really hope that the final budget will mirror the legislature's budget more closely on this issue, and we urge the state to endorse this aspect of the legislature's version. Also on Initiative 1, we're optimistic about the potential for some positive change and increased coordination through the governor's reorganization plan to create the California Housing and Homelessness Agency. So on the subcommittee, we support the creation of an agency that's specifically dedicated to housing, and we really appreciate the state's efforts to streamline affordable housing production and increase housing supply. And we feel that department level leadership on housing issues is really crucial so that these stay at the forefront. And we hope that creating this more efficient system for the developers of affordable housing will also allow the state more time to focus on enforcing civil rights and strengthening programs for people with disabilities. There were two bills that I wanted to touch on that we think address Initiative 1. I'm not going to go into too much detail about these, but Corinne will add some more insight into these. So the first is AB 1229 by Member Schultz and Quirk Silva. So this bill just proposes transferring administration of the Adult Reentry Grant Program, which assists, among other things, it assists rental assistance to support reentry of individuals transitioning from prison to communities, many of who have disabilities and are older adults. Transitioning this program administration to the Department of Housing and Community Development. So this really supports our priority of continuing to invest in housing supports through coordination, so putting housing programs in housing agencies that really have the expertise in running these programs. And so we are supportive of AB 1229. The second bill I wanted to just touch on, it was AB 282. So this furthers Initiative 1 by protecting the supply of private housing for voucher holders. So AB 282 is by Assemblymember Pellerin. It just clarifies that it's not considered discrimination to have policies and preferences that favor tenants who qualify for or participate in local housing subsidy programs. So this bill really protects housing providers who want to offer housing to folks with vouchers or other housing subsidies. And many times the people that have vouchers or are using housing subsidies are older adults and people with disabilities. So both of these bills are just good examples, we believe, of furthering the initiatives of the MPA without extensive budget asks or program changes, and we're supportive of both these efforts. Hold on one second. Okay, sorry about that. So I'm going to move on to Initiative 6 to just discuss some of the priorities that came up related to that initiative. So as a reminder, Initiative 6 states the goal of continuing to help older adults and people with disabilities obtain housing stability through HomeSafe and the Housing Disability Advocacy Program, or HDAP. So we are recommending that the state support continued funding for HomeSafe and increased funding for HDAP. We were greatly encouraged by seeing the legislature's budget, which proposes restoring funding for HomeSafe at 83 million, and then increasing the HDAP funding by 45 million. Again, the May revise had no funding for either of these programs included. The legislature's proposal is just one-time funding that's available until June 30th, 2027. So this is going to remain a priority issue for our subcommittee. But this is listed as one of the initiatives. So this is really one of two programs that we believe are big priorities for our population. Without the continued funding for HomeSafe, PDSS estimated that most of the HomeSafe County grantees are going to exhaust their funding or close operations within the next 6 to 12 months. And as of April 2025, 8 of the HomeSafe programs had already closed, and it was estimated that 26 more would close in July, so for us next month. HDAP, as most people know, has a small ongoing appropriation. It's just 25 million, which does seem like a lot, but this is a significant reduction from the previous funding amounts. So at one point, HDAP had 100 million and 150 million allocations. So the significant reduction from that level of funding. So the additional 45 million that was listed in the legislature's budget really would be very helpful, help the program continue to stay accessible to a greater number of people with disabilities. And we know, I'm not going to go into too much of the data around the programs, but we do know that advocate groups have budget requests for HomeSafe and HDAP in front of the legislature. So again, we are really thankful that the legislature recognizes the dire need for these programs, and we urge the state to support these programs as well. So on Initiative 2, so that again sets the goal of promoting promising practices and encouraging replication of innovative public-private housing solutions, including rental assistance subsidies and shared housing models. We wanted to mention just a few bills that could help further this goal and kind of represent priorities around shared housing and tenant protections. The first is AB 474 by Assemblymember Ward. So this bill is about home sharing. It would encourage the growth of and participation in nonprofit home sharing programs by exempting the income received through renting bedrooms as a landlord. So this income would be exempt for purposes of determining eligibility for their social services programs, so like CalFresh or Medi-Cal. So by doing this, this bill really encourages more folks to rent out rooms and home sharing programs and helps increase housing options for people with disabilities and older adults. The other bill we wanted to mention is about eviction protections. So it's SB 436 by Senator Wahab. It proposes to extend the notice period for tenants who are in default in the payment of rent from 3 days to 14 days. So this change could help many people, including people with disabilities and older adults, avoid eviction, housing instability, and potential homelessness just by giving them more time to pay back any overdue rent or time to access legal services. So the current system of only giving the tenant 3 days to pay back rent or access legal assistance, it really doesn't provide tenants enough time to pull together the funds, figure out what they want to do, or seek local rental assistance to help pay back what is owed. And so, as we know, for people with disabilities and older adults living on fixed incomes, one financial setback can really be disastrous for housing stability. So, although it's kind of a pivot, but it's eviction protection, but it really does help address this issue and kind of fight the upstream causes of homelessness for people with disabilities. So both those bills, we are supportive of kind of the way they are tackling the goals of Initiative 2. I wanted to provide some time now for Corinne to give some input on the priorities I just discussed.
So one of the things that, just to expand a little bit more on why AB 474 has so much potential. I live in Santa Cruz, and we have, along our cliffs as an example, $3, $4, $5 million homes. Many of them are occupied by widows who are on a fixed income. It's a 2-story house. There are 4 bedrooms upstairs and 1 bedroom downstairs. The exciting thing about allowing home sharing without penalties is that my older adult who has this big house can bring in someone who can either pay rent or perform, as an example, in-home supportive services duty. It allows the housing of someone who could probably very well be an older adult as well, while the older adult who's already in that home is able to have the services. Because when you're living in a house that size, they're usually living in one room downstairs, one room, one bathroom, and access to the kitchen. Many of them haven't been upstairs in those homes in many, many, many years. It's space that could go to someone who's on the border of homeless or is homeless, or another older adult who just needs a safe, good, safe space to live in. And I think that that's not only the issue or the probability of what's happening here in Santa Cruz, it's probably across the state of California, where you have pockets of very, very well and expensive homes versus homeless folks. I guess in summary, when we're talking about housing, and we're sitting here at the apex right now of shutting down access to services and cutting funding for those with some of the most need and reversing many of the gains we've seen to right the ship for older adults, the disabled and others. We have to remain vigilant to what the future will look like for them if we do not continue the push, the dialogue, the battle. Housing is first, followed by wraparound services if we want to keep reentry individuals on the straight, low-income older adults with a roof over their heads, and disabled folks able to remain independent and thriving. These initiatives all speak to the ability to do that. And if not that, take this vision with you. The vision of an 80-year-old sleeping on the ground on cardboard in a dilapidated tent. That ought to shake us all to our very core. And we must press to engage to make sure that it is never normalized. I think at this point we could open it up to any other of our subcommittee members that may want to make any comments, or DACLAC members. Is there one?
So yeah, so just as a reminder, thank you, Lauren and Corinne. This is a good time now for the next few minutes. If any of the subcommittee for housing or full DACLAC members would like to make a comment.
Debbie. Oh, I'll be quiet.
You don't need to be quiet, Hagar. You just need to speak after me and not before me, and then we're all good. Hi, everybody. Debbie Toth again from Choice and Aging. I want to thank you for your work on this. I had Dr. Margot Cushell out for an event recently, and just to listen to the stories of the people that she's working with and the folks that are losing their housing, and that $500 a month is the difference between being homeless and having a roof over your head is freaking heartbreaking. And we can't lose track of trying to come up with a myriad of solutions. We can't just build housing. We can't just think in the ways that we used to think about people taking care of themselves. We are all in this together, and I deeply appreciate your work. I was very heartened to see that the legislature reinstated the funding for the housing program. I guess my question is, how best can advocates elevate these important programs and legislation? Is this letters? Is this calls? Is this social media? Like, how do you find the most effective ways to support the legislation that you reviewed? Thank you.
I think it is, yeah, contacting your representatives, although I do think the legislature is really supportive of, I mean, both of HDAP and Home Safe. So yeah, I think it really comes down to, yeah, figuring out how to prioritize that, knowing that those programs are so efficient and effective. I think it's always helpful to call your representative, but I do think we have received a lot of support from the legislature. They do understand the benefit of both those programs. So yeah, really, we are just hoping that the compromise includes that funding as well.
Great, thank you. Carolyn.
Good morning. Thank you. Carolyn Navo with Disability Action Center and DAN Coalition. And I just want to voice that we very much appreciate the support for the home sharing and for the adjustments that would benefit not only the participants, but also the awareness at a statewide level of how critical these programs are. We are very strong advocates of home sharing in our rural region. And I'm happy, very pleased to report that the initiatives of the Master Plan for Aging have been an impetus in our region for expanding our home sharing efforts. It's created collaborations. For example, the Disability Action Center is just about to fold together with our local home sharing agency, which is Home and Heart, who has now a 6-year record of providing services with home sharing to our most vulnerable population. Just as an example, we worked with the Brain Injury Coalition, worked with Home and Heart to house a individual with a challenging brain injury situation because their particular brain injury had a subset of anger outbursts. And it was very hard to keep them housed in traditional housing, but we were able to match them with someone who, just by virtue of their personalities, they were calming for each other. And we just celebrated their 4-year, what we call matchiversary. So these two individuals have now been living together in the community in a home sharing arrangement for 4 years and see no end to their relationship. And they have created a very strong friendship as well as family bond. So, Connie, thank you for bringing out the reality that the homes are there. The individuals in a 4-bedroom, 3-bath house with, one person living downstairs, there is housing that we just want to raise awareness to, and we're doing our part. And it all came about in our region as part of the Master Plan for Aging Initiative. It's one of the things that we work towards.
Thank you, Carolyn, for sharing that wonderful story and the importance of expanding home sharing. Janie.
Okay, there I go. I just wanted to say home sharing to me has always been such a vital program, and one that I really want to see expanded. You know, as we age, California is aging at such a rapid rate. We're going to see way more individuals living in these large homes by themselves, or their spouses die and they're all alone. My biggest issue, I mean, I live in Los Gatos. I look at my own neighborhood, how many of us are living in these homes. We have 3 or 4 bedrooms available, but people do not know or understand these programs. So that outreach effort, I think, is absolutely essential. And it's also convincing folks that have these homes that this is going to be a plus for them, not a negative. They don't understand the process, and they really don't understand how it's going to be a great opportunity for them to have companionship when they're lonely, and something, you know, to really put those positives forward, and to dispel the fear that might be there for those folks that don't want to go into this program. So thanks all for your efforts.
Thank you, Janie. Andrea?
Just a quick comment. I really like the share housing program. I know someone personally that have a 4-bedroom house. They hardly leave stairs, and they would love to rent or assist someone in regards to housing needs. And I don't know if many of you all know that LA County Housing Authority actually offer really nice incentive to encourage folks to rent their space in their home. I mean, they help in regards to the down payment, of course, a payment, and then they also help with other resources and services for the person that's renting their room. So I think it's great. We don't have to worry about funding in regards to building more homes. There's already homes available, but a lot of people, like Corinne was saying, that a lot of people have large homes and not able to even go upstairs because maybe health issues or things like that. So I think it's a nice alternative way to help people that's unhoused.
Thank you, Andrea. Corinne, do you want to close us out with the last comments on this particular subcommittee report?
I just did want to say that the exciting thing about this bill, the Assembly Bill 474, is that it involves nonprofit agencies such as mine and others. And what makes it nice is that both sides of the people are vetted, background checks, etc., and a match is made. If there develops issues, there's an opportunity to mediate them. So it's some of the scariness is gone from having someone that you don't know or that isn't a friend of a friend in your house. And again, just as everybody that precedes me has said, it makes housing available in a very, very affordable way to folks that have the space and would share the space where they're able to be a match made. And it's a thing of not just the current, but it's the thing of the wave of the future, I suspect. I'll defer to Lauren for final comments from us.
I think that was all we had. I thank everyone for just the really helpful comments after our presentation. Thank you, Sherry.
Yeah, you're welcome. Thank you. Excellent presentation and some very positive information and movement in supporting housing in our community, especially since we have lots of negative that we're dealing with on a daily basis. It's nice to hear some positive stories and positive work that's being done. I'm going to send it back to Hagar to introduce our final subcommittee.
Great. So we're going to hear from the Transportation Subcommittee now, led by Michelle Rossi. Michelle, are you on?
I am. I was not able to pull up my slides to be able to read from. Um, and I know that they weren't supposed to be put up because we got to you guys late. But wouldn't it be nice if we were all able to get where we needed to go when we wanted and needed to? I There's a lot with the transportation subgroups that the subcommittee's been working on. If somebody could pull up those slides even privately and kind of read them for me, I'd really appreciate that. I've been trying for the last 15 minutes to try to pull them up, and I can't find them, and I really do apologize to the group. We're working on.
Michelle, I'm going to interrupt you. They're asking the translator for American Sign Language is asked to please co-host. Sorry. Thank you, Michelle.
Problem.
Michelle, I think Dina has them available, who is part of your subcommittee. So maybe Adina can read off of the slides. I don't know that they can be shared, but certainly she can read off of the slides and present with you. And I'm happy to copy and paste some of the information into the chat as well.
That would be wonderful. Thank you. Yes, Adina, if you could go ahead and do that. I had them up on my computer and they disappeared when I was doing other stuff. So thank you guys. Yes, Adina Levin from Seamless Bay Area is who supports me in my role as chair of the subcommittee for transportation. She's going to go ahead and read from the slides that we would otherwise have presented, but they got late. But we're good. Thank you, Adina.
Yep. So one of the main initiatives that we were working on was on getting a funding assessment of all right, this is working on the Transit Transformation Task Force. This is a state level task force that was created as part of the 2023 budget agreement that is providing funding to keep public transportation running, and then creating a task force to provide a set of recommendations to the administration and the legislature to improve public transportation. The final report for this is due on October 2025. And while the initial work of that task force was somewhat unclear as to how this would include accessible transportation, thanks to the efforts of members of the task force and technical experts on the advisory committee and members of the community speaking up. The final report will include a set of good recommendations to improve accessible transportation. Those were scheduled to be reviewed by the task force this week. However, that meeting has gotten rescheduled due to events in Los Angeles. The upshot there is that there are good recommendations about funding and improvements to accessible transportation that are going to come out of this task force. The next item is about the high priority issue that it is extremely difficult to improve accessible transportation for seniors and people with disabilities because, as we have been reporting, there is a significant lack of knowledge as to how much it costs to run the system that we have, let alone to improve it. And there was a bill, SB 1121, giving CTC the responsibility to do a cost assessment of how much it costs to run the state of California's transportation system in all modes. The bad news is that that task force did not, they determined that they were not able to put together the assessment of accessible transportation within the time that they had allotted. but one of the recommendations that they had at their conclusion in their report is that a recommendation to complete that funding assessment for accessible transportation. So that too is moving forward. One other item that I will report from a meeting that we just had this week, and one of the issues in terms of implementing the master plan for aging was on the status of providing accessibility with TNCs like Lyft and Uber, as well as autonomous vehicles. We got a presentation from the CPUC on the status of implementing the current law, and the group has made a set of recommendations, including that because of the progress on autonomous vehicles since I believe it was 2018 when the law was passed, that the group would like to see additional legislation providing accessibility requirements of autonomous vehicles in addition to TNCs. And I'm also desiring the legislation for the TNCs to accommodate additional forms of disability in addition to wheelchair access, which is currently required, and to provide more transparency in where the funding being raised by the funding in the legislation is being allocated. And those were the recommendations that were made by the group yesterday.
Thank you, Adina. The group's been working really hard, and with the help of Adina's group and other people who come and are on part of the committee, we've been doing great work over the last couple of years, and we hope to do more over the next year or so. And I'm going to put it back to the group for questions if they have any. Thank you.
Thank you, Michelle and Adina. So we'll open it up to comments from subcommittee members and from DACLAC committee members, and then we'll move after that to, I believe, public comment, and then public comment. The public can make comments and participate as well. So we'll start with DACLAC committee members. Do you have any questions or comments? Debbie?
You knew I was going to make a comment, right, Hagar? Yeah.
I was hoping.
Hi, everybody. Debbie Toth again from Choice and Aging, the most prolific speaker in this meeting today. Sorry. I want to thank Michelle Rousey for her leadership. I think, we started this committee a few years ago really wanting to address the first thing that Michelle said, which was, shouldn't everybody be able to go where they want, when they want? And they can't. And in my 23 years at Choice and Aging, the most impenetrable space has been transportation. We have made progress in so many other areas, and we've made progress in transportation on paper. We have not made it in practice, and that has to change. It can't just be that we have a voice but no action. And I think that's where I keep seeing ourselves. I will just share, in Contra Costa County, we actually have an accessible transportation strategic plan, something I never thought would ever happen in my lifetime, given how difficult it is to move mountains in this space. However, it was supposed to be implemented 2 years ago. And we are still at a point where we're fighting over the bylaws. We just passed them at the Paratransit Coordinating Council, but now we have to dissolve the Paratransit Coordinating Council, create a new body. Like, it's amazing to me, the numerous barriers that are in place. I want to thank CDA for their role in the master plan for aging, bringing back what the original recommendations were, adding to new ones each year, engaging CalSTA, engaging Caltrans, but yet we're still fighting on the regular to be included in every place and space. And I know that a lot of us don't think about the experience of somebody who has a disability who can't drive a vehicle, but when it came to the hearings that we had a few weeks ago when the May revise came out and we had Senate and Assembly sub-budget committee meetings, there were people who had been there all day waiting to testify. By the way, the Assembly meeting started 3 hours late. And people who had been waiting there all day had to leave early to catch trains because that was their only form of transportation. So they didn't get to advocate, even though we only could say our name and oppose or support. That was kind of ridiculous, but that's a whole nother story. But I cannot stress strongly enough that we can put all the pieces of the master plan for aging in place and make a totally accessible physician appointment or park or job or whatever. But if people can't get there when they need to go, there's no point in having it accessible. So Michelle is terming off as the chair of that committee, and I led it for the first year. I am not somebody who has a disability. Well, I do, but we won't talk about those. Those are not visible and they're not functional, like in terms of driving, but we need somebody who has that lived experience to lead this. And so I'm just imploring you, if you are not experiencing inaccessibility in transportation, but you know somebody who is, to please look into joining DACLAC, to please look into joining that transportation subcommittee. We need a leader and a voice of lived experience. And I think that matches what our values are. And for those of you who aren't into transportation and have never dug into it, please take some time to do that because it is one of the biggest barriers to life. Thank you.
Thank you, Debbie. Jeff?
Yeah, I just wanted to give a okay, sorry. Just want to give a brief update on AB 1250. This is Jeff Tom with the California Council of the Blind. So our bill that we are sponsoring would essentially no longer require individuals who are paratransit riders and who have been deemed eligible on the basis of their disability for permanent paratransit status, that they would not have to be recertified in terms of their disability. We are taking some amendments, I believe anyway, that's what I last heard, from the transit districts that would require the districts to set up a streamlined procedures along the lines that our bill had proposed. And so it looks as if the bill is currently already in the Senate. So it looks as if we are, taking amendments from the transit agencies, that we have a good chance of getting this thing through. And I think ultimately it's a good result, a small change, but a good result for paratransit riders. So thank you.
Thank you, Jeff, for that update. Are there any other DACLAC committee member comments? Andrea.
You know I have to make a comment. Michelle, great work, great work. In regards to transportation, I utilize transportation a lot. I still drive, but my main mode of transportation is public transportation. It's also good to know that they're working on a recertification because every year, well, I think maybe every 3 years, I have to go through recertification through Access. And then folks that I help or introduce those alternative to transportation, I have to help them with the recertification. So that's wonderful. Yes, transportation is very important. I just happen to live in a city, Claremont, where we're actually a transportation hub. And so transportation is so important. I just helped someone that was pretty much homebound and could not get out the way she would like to get out. So now she was introduced to volunteer drivers. So now she can get out and get her hair done, go get something to eat. And it's such a game changer for her. So great job, great work. And I'm a big supporter of transportation. You guys hear that train going by, right?
Thank you, Andrea. And Michelle, do you want to make a final comment and summarize your comments as well?
Yeah, both. Thank you, Hagar. Yeah, we are looking for somebody else to kind of take over as chair for the transportation sub. So if you're interested, just put out a good word. And if you're a consumer and worried about the logistics of doing that, please ask questions because right now I have the support of Adina's group, Seamless Bay Area, to help me in my role as chair. So, and it's a possibility that that could also be forwarded to the new chair if it's a consumer who needs those supports. And you know, we all kind of disconnect when it comes to transit as being part of a need a lot of times for our consumers. But you know, we can't go shopping, we can't go to the doctors, we can't get those other community support unless we have transportation a lot of times. Although some of them are brought into the home. And I think transportation is just one of those things that people say, oh yeah, it's there, but they don't worry about how accessible it is and that it's not a concern to them until they're in need of these special services. And, you know, for me, I just want to be able to go and get where I'm going when I need to. And I don't want to have to worry about setting up a ride a day or two before. I just want to be able to go. And I think that a lot of people with disabilities are the same. They just want to be able to get up and go like anybody else would. So thank you, Hagar, and thank you to the committee. Thank you.
Thank you, Michelle, and to the Transportation Subcommittee. And we're going to move to
Can I
public
just say
comment.
one thing, Hagar? I'm sorry to
Yes.
interrupt. I just want
Oh,
to say a special word of appreciation for Michelle's role in chairing the subcommittee. I know she's really worked hard and with the support of Adina. Thank you, Adina. But really hope that we can find another subcommittee leader like you, Michelle. So appreciate your work.
thank you. I'm going to transition us to Carol right now. Hi, Carol.
Hello. Let's bring up the slide. Thank you. This is our second public comment time. So if you would like to have a comment, raise your hand or *9. And I see a couple hands. We have Jeffrey. Do you want to go ahead, Jeffrey? You can unmute yourself.
Can you hear me this time?
Yes, you are coming through. Go ahead.
I already know about my concern about Ken McCoy wage and getting a cabinet level position. I reside here in Sacramento, and they have just replaced with a low floor light rail vehicle that is not even. And we have disability people that simply cannot even board the vehicle. So respond to the public transportation. I know there was a study going on with Caltrans before. I hope that I will be added to, should we say, meeting agendas, so I know more things like this that are occurring. And yes, Michelle, I hope we'll see you Monday at the first Disability Capital Action at the Capitol. And we'll be listening to what's going on here for the Master Plan on Aging, because all of these housing and other concerns are totally something that needs to happen. But I think making sure that we have somebody in the inner circle of the cabinet knowing what's going on and supporting and directing what needs to happen for the Master Plan of Aging. And that's my public comment today.
Thank you, Jeffrey. We appreciate it. Okay, we have Christina Roma. Sorry. Christina, go ahead. You can unmute your line. Christina, are you able to? There you go. Go ahead, Christina.
Hi, I was actually just responding to the Michelle was actually the one that told me about DACLAC. So I am a person who uses a wheelchair and I use transportation a lot. So I would be actually interested in doing that because, like, as you just brought up that some transportation just isn't um doesn't serve who it's there for, the whole population, like Michelle said, that we just want to get to appointments and stuff, and currently that isn't happening. So I would be happy to, or I would be okay with stepping up for doing that. So let me know.
Christina, can you see the slide in our Engage email box, engage@aging.ca.gov? If you could
Yeah.
send us your contact information, we could forward it to the Transportation Subcommittee leadership. And thank you for your interest.
I'll do it. Thank you.
Thank you. Okay, Yolanda, I'm going to unmute your line. Oh, nope. Yolanda put her hand down. Yolanda put her hand up. Go ahead, Yolanda.
Okay, thank you so much. Hopefully you can hear me. I just want to comment on the wonderful presentation on shared housing. That was absolutely incredible. We really appreciate it, especially here where we're located in South Los Angeles. So hopefully we'll be able to have those opportunities as well. Thank you again.
Great. Great to hear various parts of our state are on the line today. Of course, at any time, you can send your comments to our Engage email box. Let me give that to you again. Engage, ENGAGE, @aging.ca.gov. I'm happy to take your written comments at any time.
Carol, looks like Michelle has a comment as well.
Okay, Michelle, let me spotlight you. Hold on.
There we go. Hi. If staff could put out I appreciate you guys putting out the email, but for people to be able to engage in the recruitment that's going to be coming this fall for the full DACLAC, so that they have a way to communicate back to you their interest in the transportation, but not only that, the full DACLAC, because they would have to become a member of the full DACLAC to be able to be chair of the sub. So I just want to put that out, and I welcome people wanting to join and see what it's about prior to just engaging on just being chair, so that you understand more about what the committee and the subcommittees are doing. Thank you.
Thanks for those reminders, Michelle. It doesn't appear that we have any more hands. Again, anytime you can send your written comments to Engage, ENGAGE @aging.ca.gov. Also, the email is in the chat. Unless there's anything else, Hagar, shall I turn over to Sarah?
Yes, that'll be great. Thank you.
Okay, well, I am just so appreciative of this committee and the hard work of our co-chairs, of course, Hagar and Sherry in pulling all this together, but our subcommittees, all of you are just doing an amazing job in elevating the issues that we need to be aware of to continue moving in our implementation of the master plan for aging, while also engaging our state partners. And I do want to really emphasize how appreciative we are as well of our state partners who take the time to listen, attend, and reflect and respond to these issues as well. So thank you for that. A few things I just wanted to plug. Several months ago, we mentioned to you that we were in the process of standing up an Aging and Disability Lived Experience Advisory Board, which was one of the key recommendations from our stakeholders at the Day of Action. And I'm really pleased to let you know that we're really close to launching it. We're doing, some of the interviews right now, and it looks like our first meeting will be sometime in August, most likely. So we hope that for the next meeting, when you all are here, we can engage our Equity Advisory Committee members to do a report out and kind of elevate some of the key themes and who the people are that are on the committee. So very excited about that. And then also I wanted to let you all know that 2 other key initiatives that you all have been tracking. One is the Home and Community-Based Services Gap Analysis, as well as the Long-Term Services and Supports Financing Initiative. We're going to be releasing a lot of the work related to those initiatives this summer and having kind of a symposium, which is pretty much a 2-part webinar it's looking like July 31st, starting at 10:30. And we will be reaching out to get engagement from many of you, to reflect on some of the work that is underway. So just wanted to flag that for all of you. And I think that's about it, but I just want to close by saying appreciation for our CDA team here that makes all of this happen. It just has been a wonderful engagement. We learn a lot from all of you, and that's how we like these stakeholder meetings to be, where we're listening and we're reflecting, and that's how you all have done it. I know it takes a tremendous amount of work for each of you to be part of this, to engage in between meetings, but it's what makes a difference. And so I think you have kind of set the bar for what stakeholder engagement should look like. So thank you all. And with that, is there anything else, Carol, that I need to close out?
There's a couple of closing slides, our meeting resources, and that'll be a part of the deck. And our next date, October 9th at 10 a.m. And please check our Cal HHS DACLAC webpage for all the meeting materials for today, including this recording.
Thanks, everyone. Have a great day.
Thank you.
Thank you.